name is Renato LaRocca. I'm actually a cancer medicine specialist and a board-certified neuro-oncologist. I grew up in northern Italy, and while I was in the high school years, I was influenced by a very famous Italian cancer medicine specialist named Gianni Bonadonna, who had done a lot of work actually in the United States. And I had met him, and I think he was probably the inspiration and in some ways a fundamental mentor that helped me in my decision to go into medicine. Two major mantras. One, I want the best possible outcome for the patient, whatever that may be. And then number two, I want to serve as a beacon on his or her life path. So it's important for me to convey to patients my knowledge of the field. I'm a big believer in scientific method and in clinical trials and in the healing process, recognizing that science is important, but the humanistic component is equally important. And so it's very important for me, if not critical, to have a dialogue with the patient focusing on his or her life path, needs, preservation of dignity, preservation of autonomy, and it's a dialogue. It's a dialogue over time. Well, I think some of the things that are important is, again, an attempt to understand the human dilemma and recognizing that everybody's life path is very, very different. And again, it's very important for me to impart knowledge and, if possible, help them understand the choices they have. But it is ultimately the patient's choice of what is best for them, their family, and what allows them to create legacy, always preserve dignity, and in the end it's always about the relationships. And I strive for that dialogue with the patients in the context, of course, of recognizing that cancer is a critical illness, that we've made tremendous strides in the last 10 to 15 years, and that it's very important innovation, thinking outside of the box, clinical trials, and I always try to give my patients that option whenever possible.